Hi everybody, welcome to Dr. Manny's YouTube Learnshops. In this session we're looking at nursing sciences, specifically the philosophical traditions. Just an overview. The learning objectives for this session basically are, or the outcomes are, for you to comprehend the concept of philosophy. And look, it's really broad. The philosophy of nursing in the nursing profession, the significance of philosophy to nursing, the rationale for philosophy in nursing, and philosophy development in nursing. And look, it's a huge topic, which again, we will try and cover in this session. So, what is philosophy? Philosophy is derived from the Greek word philos, which means love, and sophia, which means wisdom. And it's the loving and searching for the wisdom and the truth that is important in philosophy. Philosophy in its broadest sense is wondering and being curious about the big or fundamental questions which have occurred throughout history. Questions about what is real, which is ontology, which you need to investigate. What is knowledgeable, or what is knowledge, that's epistemology. And an additional component is ethics, what is just. And there is an art to caring, which is called aesthetics, which we'll touch on briefly as we go through. And these are fundamental questions that are related to humanity. Philosophizing in the West has got its roots in Greece. And etymology, the word is derived from the Greek and the Latin, philo, which I said already, which means loving, and sophia, which means wisdom. In addition, it's to search for wisdom through self-inquiry. Philosophy is commonly understood as the study of problems that are ultimate abstract concerns of all human beings, and they're concerned with the nature of existence, knowledge, morality, and purpose. While interestingly enough, academic philosophy, which is what you're involved with as well, includes problem solving, critical questioning, and it also goes beyond these thinking skills when people include nurses, because nurses reflect on the meaning of their experiences, consider how they might evaluate truth of an observation, and or try to determine the best course of action in a particular situation. They're engaging in what is called philosophical thought. Now, philosophy has many origins. And this is Johann Gottlieb Fichte, who had an era between 1762 and 1814. And he described philosophy as the science of knowledge. In German, it's Wissenschaft der Lehre, which means the doctrine of scientific knowledge. Another important philosopher is Samuel Taylor Coleridge. His era between 1772 and 1884, and he basically said philosophy was the science of all sciences. So philosophy then defined is the study of fundamental nature of knowledge, reality, existence, especially when considered as an academic discipline. It's also considered to be the sciences that comprise of logic, ethics, aesthetics, as I already said, metaphysics, and the theory of knowledge. It's a set of beliefs, values that guide us as practitioners, the way we operate in the world. And also, it's a statement of beliefs that guide behaviour, for example, our nursing practices. There are two categories of philosophy. And philosophy as an academic discipline has got lots and lots of branches and subcategories. However, for our purposes, we present an overview of philosophy based on the approach which is used in most Western universities, where philosophy is categorized as either being analytical or continental in orientation. Analytic philosophy is the focus on logic, And analytical philosophy emphasizes the prominence of logic in analysing, defining and separating various parts of a question and the multiple interpretations of abstract concepts. Logic, in this context, is the study of strict or deductive proof, which is concerned with the soundness or lack of soundness of reasoning. And we use a systematic approach, which is similar to the scientific process. Analytic philosophers often apply sets of rules of logic when trying to answer questions. And this approach usually begins by asking for definitions of ideas to be discussed and has been described as concept-based style analysis. In counter to that, you've got Continental Philosophy, which focuses on language. And Continental Philosophy is a more recent approach and refers to traditions flourishing in continental Europe, South America, Canada, the United States, Germany, and with French philosophies, which include Hegel, Heidegger, Habermas, Derrida, Gadamer, just to name a few. Now, nursing has philosophers as well, as we're going to be discussing, as we have done previously. And two nursing philosophers are Sally Gadow and David Allen. And many of these philosophers draw on hermeneutics, phenomenology, genealogy, which draw on this tradition. However, unlike analytical philosophers, continental philosophers are interested, as I am, in understanding the human experience and the influence of history in shaping meaning and interpretation. There's a distinct style of analysis, a particular canon of thinkers, and an autonomous set of concerns. Some authors distinguish continental philosophers by way of questions, which are posed to emphasize context, narrative, and language itself, rather than being problem-focused, which happens in quantitative research, with a search for precision and a logical, elegant argument. Sherratt suggests that it's a link between humanism that defines the continental traditions. Philosophy in a nurse's world is every nurse's business. And although analytic and continental philosophies are academic branches when used to conduct nursing research, nurses should consider philosophical thinking in their practice. McIntyre and MacDonald see philosophy as increasing a nurse's ability to theorise and provide a nurse with a way to think about their practice, a way to make sense, articulate, critique nursing practice. Other academics see philosophy as inquiring into the nature, scope, the object of nursing that can't be discovered through scientific means, but rather through your reflection and your reasoning. Philosophy as a content relates to the core phenomena of an interest to our profession and our discipline. And questions relate to person, environment, health, and nursing itself, as we'll discuss as we go through. Under the umbrella of content, nurses ontologically examine the nature of nursing, personhood, environment, health, and illness. In nursing epistemology, this attends to the development, identification, and validation of knowledge via these concepts. And nursing ethics refers to the moral phenomena which are counted every day in your nursing practice, and the basic elements of what is right, what is wrong, values, the nature of good nursing practice. Nursing practice is often central to philosophical thinking. What is nursing? What is nursing knowledge? What is considered good nursing practices? We as nurses argue regularly about philosophical ideas. You may not be aware of it, but you are, when you're making practice-related decisions for the greater or lesser degree of your nursing practice. Philosophy is a method in nursing. Nurses use philosophy to analyse, critique, challenge, debate clinical situations that jeopardise patient safety and ethical nursing care. From my perspective, this is about patient advocacy. My passion is patient advocacy. And nursing scholars like McCurry argue that philosophy prepares nurses with tools to act as moral agents in their practice, setting to develop the capacity to recognise, deliberate, reflect, and act on moral responsibilities when they see something wrong. Stated another way, philosophy offers nurses the language to raise awareness of the assumptions that might be directing nursing practices. And philosophy also enables nurses to explore non-scientific questions that may be important to the discipline of nursing. For example, using philosophical inquiry, nurses can continue to pose questions such as, what are the principles of nursing practice? What are the boundaries of nursing knowledge? Are nurses really too busy to develop a nurse-patient or client relationship? In thinking about these types of questions, we as nurses can use critical reflection and reasoning to define and advance the discipline of nursing. And this can empower you. This can empower nurses to push the boundaries of healthcare, conversations to reconsider ethical nursing principles and the role of nurses within healthcare today. Think of COVID-19, the pandemic, and the changes that have occurred as a consequence of that. So, as Mariner Toomey stated, philosophy is an attitude toward life and reality that evolves from each nurse's beliefs. What you believe philosophy to be in nursing. Look at Florence Nightingale. The philosophy of nursing states what we believe to be true about the nature of nursing profession, and it is what provides the basis for nursing activities and actions. And I agree with her with this quote. The very first requirement in a hospital is that it should do no harm to the sick. It's about patient advocacy. So, what then is the profession of nursing? Or is it a vocation? What defines a profession? And what defines a profession is, consider, a knowledge base. Power and authority that comes from education, being registered, caring altruistic services, a code of ethics, a lengthy socialisation which we've had since Florence Nightingale established modern nursing, and being autonomous and having public accountability. That's what defines a profession. What about a profession in academia? What's the difference, or what are differences of an academic discipline from other disciplines? Well, in academia, there's structure and there is a tradition. There's a specific language that we use in nursing, and there's a philosophy, which is a worldview philosophy, and there are methods and knowledge development. We use evidence-based practices, which we'll be discussing in other sessions. What are some of the related concepts? Well, related concepts to philosophy are that there are ideas, concepts, beliefs, values, moral and ethical obligations which relate to knowledge. These all relate to the basics, which we call the nursing fundamentals. Nursing process is only one concept and one tool. Then you've got concepts related to nursing models. And nursing models are derived from nursing philosophies and other philosophies as well. And they're less complicated concepts, and they address specific concepts related to person, health, environment, and nursing. And it's a systematic approach to nursing practices. So these concepts guide philosophies with thinking and decision making. Then you've got concepts that relate to nursing theories. And these are derived from nursing models, which are based on theory. And they comprise or relate to relationships that have a systematic approach to nursing practice. They are specific to nursing practices. So the philosophical foundations for nursing began centuries ago with Descartes and Spinoza in the 1600s as rationalists, and their thought was reason is superior to experience as a source of knowledge through deduction and mathematics. Then you've got Bacon, who was empiricist. Experimentation and use of the scientific method. Kant, Immanuel Kant, who's one of the most influential philosophers in history, especially related to Western philosophy, his contributions related to metaphysics, epistemology, ethics, aesthetics, and this had a profound impact on almost every philosophical movement that followed him. Nursing was one. There are numerous schools of thought when it comes to philosophy. And two that stand out are the received view, which is considered an experimental view, and the perceived view, which is an interpretive view. Now, the received view in philosophy of science is the logical, empiricist way of analysing structure. The received view is of theories, and their position in philosophy of science identifies a scientific theory with a set of propositions which are considered to be linguistic objects such as axioms. As we've mentioned previously, positivism or logical positivism was a dominant philosophy in science till about the early 1950s. So the received view, the experimental view, is about rationalism, positivism, empiricism, observation, testing, verification, explanation, prediction, statistics, numbers, deduction. It's positivistic. Then you've got the perceived view. And the perceived view encompasses the emergence and influences of non-positive philosophies, which shift the theoretical focus away from causation to more interpretive, unscientific standpoints with foundations in phenomenology, humanism, holistic care, and qualitative research. So the perceived view is about interpretation. As I said, this uncovers phenomenology, human science, experience and context, holism, patterns, understanding meaning, feminism, critical theory, which encompass gender, culture, society, and power. It's not about numbers. So, nursing philosophy and science then are considered as follows. Nursing philosophy, the epistemology, is about the nature of knowledge. It's about the ontology, the nature of existence. And it's the basis of a belief system and principles of our profession. Nursing science, as we've mentioned previously, it's a discipline, specific knowledge of human relationships to health and illness. It's a philosophy of science and nursing. Scientific knowledge is transformed into nursing knowledge through nursing practice. So, when you look at epistemology, it's how we should investigate the world. The ontology is how we see the world. The methodology is how we should collect data to best describe our epistemology and ontology. And the methods are details of exactly how we collected that data. And these are all determined by how you see your epistemology and how you view your ontology. Ontology is really about studying the structure of nature of reality, or nature, how it exists. And epistemology is about studying the potentiality of the knowledge of the human being. Ontology, it's about being, and being that exists as a self-contained or an independent human being. Epistemology, it's about human thinking cognition. So what are ways that we may know? And ways of knowing, according to Carper, who proposed 4 ways or patterns of knowing that are utilised in nursing, and specifically in nursing education and nursing practice. And these dealt with empirics, which is the science of nursing; ethics, which is the moral component in nursing; aesthetics, which is the art of nursing; and personal knowledge, which you bring to nursing. In healthcare, Carper's fundamental ways of knowing are basically a typology that attempts to classify the different sources from which knowledge and beliefs in professional practice can be derived. And they classified these 4 ways of knowing specifically for nursing, but since it's been modified for other disciplines as well. When we look at a discipline, the theory of a discipline, well, disciplines are unique. So a theory of a discipline is a unique theory or theories and perspectives used by that discipline, which distinguishes that discipline from other disciplines. So nursing as a discipline isn't the same as medicine as a discipline, or pharmaceuticals as a discipline. So theories of a discipline clarify basic assumption and values, and they define the nature and purpose of practice. So when you define a theory, it's basically a systematic explanation of events in which constructs and concepts are identified and relationships are proposed and predictions are made. It's a system of interrelated propositions used to predict, explain, understand, control a part of the empirical world. It relates theory to practice. Theories then are composed of concepts, propositions and laws, and they can be communicated. They vary according to the number of elements, characteristics and complexity of the elements and the types of relationships among those elements. And theories are invented, they're created, they're not discovered. As you'll see with our nursing theorists, which we've sort of touched on previously. Theory in nursing then provides structure and organisation for nursing knowledge. Theory provides a systematic means of collecting data to describe, explain, predict phenomena which are important to nursing. They're theories which define and clarify nursing and distinguish it from any other caring profession, one of which was Jean Watson's theory of human caring. When using a theory for nursing, it's because we want to establish standards of practice. Recognise where that practice should be set. Identify distinctive nursing processes which are going to be used, and it directs the delivery of nursing care interventions. It serves also as a basis for clinical information system and guides quality improvement programs. all nursing boards globally have a theory for nursing. What are some of the theoretical terms that we use, which again we need to become familiar with? And we have assumptions, concepts, constructs, empirical, hypothesis, models, paradigms, philosophies, and relationship statements. When it comes to assumptions, assumptions are basically beliefs about a phenomena that are accepted as true. Concepts are abstract elements of a phenomenon necessary to understand it. A construct is a complex concept, which comprises of more than one concept and built or constructed to fit a specific purpose. An empirical indicator is specific and concrete, an identifier of concepts, methods used to observe and measure those concepts or concept. A hypothesis is a tentative, not proven, suggestion that a specific relationship exists between two concepts or propositions, and a model is a graphic or symbolic representation of a phenomenon. A paradigm is an organisation framework that contains concepts, theories, assumptions, beliefs, values, and principles that form the way a discipline interprets the subject matter with which it's concerned. A philosophy, which we already have touched on, is a statement of beliefs and values about human beings in their world, and a relationship statement indicates specific relationships between two or more concepts, which may be propositions, hypothesis, law, or theorems. Now we need to review the stages of theory development. And essentially, there are 5 stages of knowledge which pertain to theory development, which includes nursing. And this is silent knowledge, received knowledge, subjective knowledge, procedural knowledge, constructed knowledge, and integrated knowledge. Now, the first stage of nursing theory development is known as silent nursing stage. And it's the most identifiable by all of us because it's at this stage where nursing was characterised as being blindly obedient to physicians. Nurses were trained in hospitals. Education was controlled by hospital and the doctors. Education and practice were based on tradition, rules and principles and focused on technical skills, and it was an apprenticeship form of education, which I was orientated to when I first started nursing. Then you've got received knowledge. And received knowledge describes the epistemological position in which women in the study perceive knowledge as a set of absolute truths received from infallible, absolute authorities, and the process of learning as understood by received knowers involved receiving and repeating the knowledge and words of authorities. It was also referred to as being dualism, received knowledge, knowledge as objective facts. This was a view of knowledge. And this is about testing for registration. This is when it began. The first published nursing research occurred. Books on nursing research and theory were being published during this period of time. There was a slow growth of graduate education and nursing questioning practices. And this was about the time that there were serious nursing shortages. And a specific act in the UK, the Hill-Burton Act, increased the need for nurses. So nurses were being trained. Nursing for the Future was published, which promoted nursing education in universities. Then you've got subjective knowledge. And subjective knowledge was knowledge from a multiple source, and it was knowledge based on subjective experiences. It viewed knowledge in some areas. The truth was not known. There were differences of opinion that were legitimate, but when facts are not known, one theory or opinion is as good as another, so long as it makes sense, was the perspective from subjective knowledge. And it was Dickoff and James who first published articles on theory development and the theory for a practice discipline, and this involved nursing theorists. Nursing theorists started to become recognised, and they began to evolve. Procedural knowledge in the 1970s, right through the 80s, was known as imperative knowledge or relativistic procedural knowledge. And it was a type of knowledge that was exercised in the performance of a task. It's basically how you know to do something. And nursing viewed it as an academic discipline. Theories became a framework for nursing. More nursing theories evolved, created, were published. Books were published on nursing theory, evaluation, critique, application, construction. And graduate courses on nursing theory evolved and were implemented. There was a consensus which developed regarding the common elements in nursing, which I already touched on previously, which is to do with the person, the patient, the client, health, the environment, and nursing. And this created a nursing meta-paradigm, which we'll discuss. Then you've got constructed knowledge. And this is a commitment to relativism. Now, constructed knowledge is the knowledge construction process that relates to the extent to which educators help their nursing students to understand, investigate, and determine how implicit cultural assumptions, frames of references, perspectives, or biases within a discipline influence the way in which knowledge is constructed. It's the incorporation of philosophy of science into nursing programs. And most of the time, it's the development of middle range and practice theories. There's a hierarchy, which we'll be discussing as we go through, because I think it's important for us to understand the nursing meta-paradigms which relate to grand theories, middle range theories, and practice level theories. Then you've got integrated knowledge. And integrated knowledge has got a focus and an emphasis on evidence-based practice and application to research into practice with the use of traditional research methods. However, there's a focus on evidence-based practice which concerns middle range and practice theories to specific situations. It's the translation of research into practice. Theory, practice. So what then is the scope or the range of what these theories are? You've got 4 levels. You've got meta theory, a grand theory, a middle range theory, and a practice theory. Now, meta theory is knowledge about a discipline. And for a nursing theory, it's the most global, which means abstract, type of nursing theory. And it focuses on very broad issues that address the nursing profession's most important concepts. It's the relationships among human beings, health, environment, and nursing itself, which again are the main focuses in nursing. And in nursing, as I said, the meta theory focuses on philosophical issues and methodological issues. So in philosophical issues, it's world views, perceived view and received view, which I already discussed. It's about the nature of health, person, purpose of nursing. And it focuses on the appropriate level of nursing theory. When it comes to methodological issues, it's about the processes of theory evaluation and the processes of knowledge development. A grand theory provides a conceptual framework under which key concepts and principles of the discipline can be identified. It's the most complex and the most broad of theories, and it attempts to explain broad areas within that discipline. The characteristics, however, are that it's non-specific, it's composed of relatively abstract concepts and propositions, and they're not generally amenable to testing. However, they may incorporate other theories. When we look at other theories, middle range theories, they're more precise and only analyse a particular situation within a limited number of variables. Practice theory explores one particular situation that is found in nursing. So an example of a grand theory is Orum's theory, or Rogers' theory, or Roy's theory, which we've discussed and will review briefly as we go through. When it comes to middle range theories, well, these are nursing theories that are narrower in scope than grand nursing theories, and they offer an effective bridge between grand theories and nursing practice. So they're the bridge between grand and nursing practices. They present concepts and a lower level of abstraction and guide theory-based research and nursing practice strategies. Examples, for example, are Catherine Kalokaba, her theory of comfort, or Ramona Thiem Mercer, her theory on maternal role attainment, or Mariam Conti O'Hare as the nurse is a wound healer, or even the American Association of Critical Care Nurses, the Synergy model. They're more defined than nursing theories that are grand. And as I said, they contain a limited number of concepts that are operationally defined. Propositions can be tested through research, and they focus on a particular phenomena. And it's an explanation of the relationship between that phenomena, and there's a prediction. The prediction of effects of one phenomenon against another. Then you've got practice theories, which are also called micro-theories. They're prescriptive, situation-specific theories. They're not very complex, and they contain the fewest of all the concepts, and they refer specifically to easily defined phenomena, and they're limited to specific populations or fields of practice. Their objective is to prescribe and guide practice. It's to understand the duality of the practice and the environment, and it's through that understanding that a development of the proposition occurs, and it relates practice to environmental meta paradigms. Examples, as you can see in front of you, they're all philosophers. Nightingale was our first. You have others like Wiedenbach, Henderson, Abdallah, Hall, Watson, Benner. I don't include them all. You can review them if they're important to what you want to research or practice or know. Then you've got grand theories that relate to Oram, Levine, Rogers, Johnson, Roy, Newman, King, Roper and Logan and Thierry. Then middle range theories consist of Leiniger, very famous, Newman, Peplau, Orlando, Page, Michel, Barnard. So when we look at some of the theories, what are some of the types of theories? You've got descriptive theory, explanatory theory, predictive theory, prescriptive theory. Descriptive theory is basically a first level theory of development. It describes, observes and names concepts. It describes what is. It doesn't explain how or why the concepts are related. It just provides observation and meaning regarding a certain phenomena. These theories explain, relate, in some situations, that predict nursing phenomena. They describe phenomena and speculate on why they occur and describe their consequences. As I said, descriptive theories are the first level of theory development. They describe phenomena They speculate on why they occur and describe their consequences. An example of a descriptive theory is something related to grief or caring, which can't be measured quantitatively. Then you've got an explanatory theory. An explanatory theory relates to concepts or propositions which relate to one another. They attempt to explain how or why concepts are related, and they focus on correlations or rules that regulate interactions. And these are developed through statistical or correlational research. A predictive theory explicates or explains conditions under which concepts are related, and relational statements are able to describe future outcomes consistently. This is experimental research, and it's used to generate and test theories, cause and effect. It predicts future outcomes. So for example, Billy is getting bigger. He's becoming obese, and he's at risk of chronic childhood diseases, for example, type 2 diabetes. And through his school nurse, Billy will be educated on healthy eating choices and the importance of exercise and playing outside and being active. Because predictive theories predict future outcomes. Then you've got prescriptive theory. And prescriptive theory relates to activities that are necessary to reach defined goals. A prescriptive theory is one that says how people or things should function as opposed to how they actually do. It describes the prescription, which is the action or intervention, the consequence, the type of patient, and the condition. So, if a mother who smokes cigarettes stops smoking, then it will probably mean that her fetus will grow nicely and it will have the correct weight at the time of birth and delivery. At the top of the pinnacle, you've got nursing as a meta-paradigm. And this is a global perspective of a discipline and the primary phenomena of interest to the discipline. It explains how the discipline deals with the phenomena in a unique manner. The characteristics are primarily that the domain is distinctive from other disciplines. Nurses are unique. They encompass all the phenomena of interest for that discipline. They're perspective neutral, which means the concepts and propositions don't represent a specific perspective or worldview. And they have to be international. They have to apply to everybody in nursing, in scope and substance, and don't reflect national, cultural or ethnic beliefs and values. To quote Jean Watson, nurses are unique. They have an insatiable need to care for others, which is both their biggest strength and a fatal flaw. Related concepts. Most nursing theorists consider that nursing meta-paradigms are consistent with person, man or client, patient, health, environment, and nursing. And some academics like Jean Watson and others add caring. What's the person? The person refers to, or can refer to, physical, intellectual, biochemical, and psychological and psychosocial needs. The human energy, it's holistic, it's open, it's integrated. A being who is greater than the sum of his parts. We're looking at the person as being whole, not just the heart, the kidneys, the bowel, etc. Then you've got health. Health is seen as the ability to function independently, successful adaptation to life stresses, achievement of one's full potential, unity of mind, body and soul. A concept reflecting the greatest diversity in nursing theory. Environment refers to external elements that affect the person, the internal and external conditions that influence the organism or the human being. Significant others with whom the person interacts, social. An open system with boundaries that permit an exchange of matter, energy and information, the environment. Nursing then is seen as a science, an art, a practice discipline, and the goals of nursing include to care of the well, care of the sick, assist with self-care, help individuals attain their full potential. Nursing. Noted historical nursing philosophers, which we do need to review if we want to understand the development of nursing philosophies and sciences. You've got Florence Nightingale. Florence Nightingale was the first nursing theorist. Unsanitary conditions posed health hazards, which was noted in her book Notes on Nursing in 1859. There were 5 components to environment: ventilation, light, warmth, efflua and noise. And external influences can prevent, suppress and contribute to disease and death. Nursing concepts, or Nightingale's concepts related to nursing, were person, environment, health and nursing. The person, the patient who's acted upon by the nurse. The environment, the foundation of theory, includes everything physical, psychological and environment. Health is maintaining the well-being of the person, control the environment. And nursing related to providing fresh air, warmth, cleanliness, good diet and a quiet to facilitate the person's reparative or recovery processes. Nursing was to help the person attain health through observations and interventions based on knowledge. Mary Seacole, she was a Jamaican healer, a brilliant woman who combated racial prejudice, and she was known for her medical work in the Crimean War. Virginia Henderson, she stated that the unique function of a nurse was to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death, and that they would perform unaided if they could and had the necessary strength or will or knowledge, and to do this in such a way to help them gain independence as rapidly as possible. The nurse must sense, get inside the skin of each of her patients in order to know what they need. This was her theory, the nature of nursing. Then you've got Dorothy Johnson, and she had the behavioural systems model. And in this model, the person is a behavioural system comprised of a set of organised, interactive, interdependent and integrated subsystems, and this constancy is maintained through biological, psychological and sociological factors. It's a steady state that's maintained through adjusting and adapting to internal and external forces. And she maintained there were 7 subsystems, and the subsystems were the affiliative subsystem, which is social bonds, dependency, helping or nurturing, ingestive, food intake, eliminative, excretion, sexual, procreation and gratification, aggressive, self-protection and preservation, and achievement, efforts to gain mastery and control over oneself. Lydia Hall had the theory of the core, the care and the cure. And these were 3 independent but interconnected circles. The core was the person or the patient for whom the nursing care was being provided. And they have to set goals for themselves and not any other person. And it's according to their feelings and value system. Care was the circle that explained the nurse's role, and the cure was the attention given by patients or given to patients by medical professionals. Then you have Hildegard Peplau and her theory of interpersonal relations. It was a model, and it was based on psychodynamic nursing, using an understanding of one's own behaviour to help others identify their difficulties and apply principles related to human relations. The patient has a felt need. Martha Rogers focused on her theory of unitary human beings. And she saw that there were energy fields. And fundamentally, nursing was concerned with human development and betterment. And it provided a framework which a lot of research and study has been used for. Then there's Dorothea Orum's self-care model. And self-care comprised of those activities performed independently. Self-care, there's a self-care agency where the person can perform these activities themselves, or they can't. Then the nurse meets the self-care needs by acting, doing, guiding, teaching, supporting, providing the environment to promote the patient's ability. Wholly or compensatory, partially compensatory, or supportive or educated, depending on the needs of the patient. Betty Newman's model of healthcare systems. This is where the person is seen as a complete system with interrelated parts. And basically, it focuses on stress and stress reduction. Nursing is defined as actions which assist individuals, families or groups to maintain a maximum level of wellness through nursing interventions to reduce stress. Imogen King had the theory of goal attainment. And this was an open systems framework. Human beings are open systems in constant interaction with the environment. There's a personal system, an interpersonal system, society. The nurse and the patient mutually communicate to establish goals and take actions to attain those goals. Each individual brings a different set of values, ideas, attitudes, perceptions to exchange, which was her theory. Nursing involves human beings, families and communities. Jean Orlando had a theory called the deliberate nursing process. And the deliberate nursing process is set in motion by the patient's behaviour. All behaviour may represent a cry for help. Nursing is a response to the patient's need. Madeline Leininger, she had the cultural, care, diversity and universality model. And according to her, transcultural nursing is the goal of nursing care to provide congruent care with cultural values. Her model basically said help and maintain health, recover from illness or death. Cultural care accommodation is important. Cultural care is restructuring or changing patients' lifestyles that is culturally meaningful. It's a holistic and comprehensive approach which led to a broader nursing practice and applications than is traditionally expected today. Sister Callista Roy, her role adaptation model. Nursing was seen as a process of critical thinking to assess a patient's needs and provide appropriate nursing care. And the elements were person, goal of nursing, nursing activities, health and environment. Rosemary Parsay had the theory of human becoming. And this focused on three elements. Nurses can give patients greater respect, autonomy and empowerment. Jean Watson's Philosophy and Science of Caring. And this focused on 10 curative factors. Forming humanistic, altruistic value system, instilling faith and hope, being sensitive, developing trust, promoting feelings, problem solving for decision making, promoting teaching and learning, promoting a supportive environment, and assisting with gratification of human needs and allowing for existential and phenomenological forces. She focused on the person, environment, health and nursing as well. Nursing was defined as caring and is transpersonal relationship to help others attain a higher degree of harmony. Patricia Benner, you all know. And she developed a theory that's known from novice to expert. And the theory basically states that nurses develop skills and understanding of patient care over a time period, and it proposes 5 levels of expertise: novice, advanced beginner, competent, proficient and expert. And it's these levels that reflect the movement from reliance on past abstract principles to use past concrete experiences as paradigms, which changes perception of a situation as a complete whole in which certain parts are relevant. So therefore, just to reinforce, philosophy is an attitude toward life and reality that evolves from each nurse's beliefs. Now let's briefly review traditional nursing philosophies, and there are lots. There are lots more than this here. I've focused on the ones I think are probably relevant. We have naturalism, idealism, pragmatism, and humanism. And to quote Florence Nightingale, and what nursing has to do is, in either case, is put the patient in the best condition for nature to act upon. So naturalism, or natural law, in philosophy, is a belief which excludes the supernatural and spiritual laws. The primary role of naturalists is to educate the public about the environment and maintain a natural environment. The primary responsibilities are preserving, restoring, maintaining, and protecting the natural habitat. The principles related to naturalism are that naturalists believe science is the most reliable descriptor in the world. Phenomena has to be scientifically proven. Phenomena that can't be proven are imaginary. They don't exist. And this is an epistemological claim. And this requires a hypothesis to be formed and tested. Positivism. Naturalism influences in nursing are on behaviour, practice, education and research. So in practice, nurse practitioners should be good advocates, and bad care or harm should not be provided. Nurses should learn ethical principles to provide moral care in their future professional practice, and in research, this can be related to all things that relate to naturalism. When it comes to idealism, idealism is the oldest philosophy, and it comes from the Greek word eidem, means to see. Plato was considered the father of idealism, and idealists give more importance to mind and self rather than matter and body. So principles relate to true reality, or ultimate reality is spiritual. It's mental. Epistemologically, idealism focuses on the mind and being subjective. The material world is mortal and changing. It changes. Real knowledge is in the mind, according to idealism. The human body is false. The soul is true. Nothing exists except what exists in the mind. This is subjective. This is qualitative. This is interpretive. So the influence on nursing is nursing practice focuses on holistic care rather than the medical illness model. Nursing education, students learn to consider the patient holistically, not as different parts. Nursing research focuses on holistic care, and nursing behaviour rejects medical dominance as being the ultimate in care. Pragmatism, which really does relate to nursing, is a humanistic philosophy. Human beings create their own values, reality is created and incomplete, and it's derived from the Greek pragma, action, and it's midway between naturalism and idealism. And principles of pragmatism are that man is a social and biological organism and accepts knowledge, experience from the senses. It's practical, and practice situations are considered true. Knowledge should be useful to the user, and man has the ability to shape their own destiny. Reality has no absolute value as with the positive approach. It's only concerned with the present and the immediate future. How does it influence nursing? Well, it focuses on integrating practice with theory. Nursing education, it can assist nursing science, theory and practice. Research, truth is what works in practice. If theory doesn't work in practice, it's rejected. Nursing behaviour, well, it's helpful in daily practice situations. When we look at the final, Humanism Philosophy, This is a philosophical stance that emphasizes the value and agency of human beings. It's broad, and it deals with ethics. It emphasizes a concern that humans in relation to the world. It affirms dignity, respect, the worth of all people, and it's based on the ability to determine right and wrong. This is ethics. Influence in nursing, it focuses on caring, which again we've got numerous theorists like Nightingale, Anderson, Watson and Benner. It focuses on nursing education, where students learn to consider a humanistic as well as technical related care. Nursing research is evidence-based and is practiced as such. Nursing behaviour considers cultural, ethical, moral and quality care. It considers the nursing process. So in summary, as a nurse, I think caring and respect underpins the decisions that I or we make in my or our personal and professional life. My philosophy is caring and respect for others. Philosophy provides nurses with an opportunity to become aware of how their own values and beliefs influence their practice. And nurses do. They embody philosophy in their actions when they enact that knowledge, ethics, and whole being in the care of their patients, others. It's a philosophical approach to life, and it's one that enacts nursing values and makes philosophy come to life in your and our nursing world. Thanks everybody. Check out any of the other Dr. Manny Learnshops on YouTube if you thought this was of any benefit to you. Bye for now.